Dietary guidelines typically suggest a reduction in sodium to help maintain a healthy blood pressure and reduce the risk of cardiovascular and cardiocerebral events. But previous research had also suggested that these drastic reductions in sodium may not result in a large drop in blood pressure. More recent research has shown that that drop in blood pressure is maybe up to 9%, so that would be considered meaningful. But the effects on long-term health outcomes are somewhat more equivocal, and it may well be that our average sodium intakes of around 3.5 to 4 grams per day are actually within a healthy range. It is fair to say, though, based on the research, that very low intakes and very high intakes, for example, intakes over 5 grams per day, are associated with statistically significant and meaningful increased risk of cardiovascular disease, cardiovascular mortality, and all-cause mortality. So how do we approach this? Probably one of the best ways is to really focus, rather than looking at sodium as a nutrient of interest, instead looking at the overall quality of diet, trying to eat more unprocessed foods versus ultra-processed foods, which contribute a lot of the sodium in the diet, and using salt fairly moderately, but without necessarily going to extremes.